Hello guys, hope you're all okay, you're all enjoying your life and you're also enjoying watching my videos. Today I'm going to discuss about a particular intrauterine abnormalities of the fetus, and that is called as gastroschisis. Gastroschisis actually is a congenital abnormalities, and while you're doing ultrasound you can pick this quite easily if you have seen once the images of the gastroschisis. What it is actually, it is an anterior abdominal wall small defect up to 2.5 centimeter. Through that defect, the intestine comes out, and that intestine start floating within the amniotic fluid. There will be no peritoneal covering on it, and this usually will occur at the right side of the umbilical region. So these few points are very important, like small defect on the right side of the midline, and there will be no peritoneal lining. As far as the ascites are concerned, there will be no fetal ascites, and the cord insertion would be on the normal place. The one another abnormality will be associated with the gastroschisis, that would be intestinal atresia. How it will appear on the images while you're doing ultrasound imaging, how you will pick these points. So let's start watching these images, and I will narrate on these images as well, so it will help you to identify the gastroschisis while you're doing obstetrics ultrasound. Gastroschisis would be small defect. It usually be 2.5 centimeter, and the second thing is it would be on the right side of the midline. You will be able to see the bowel would be floating within amniotic fluid, and there will be no peritoneal lining of these bowel loops. It will be freely floating within the bowel loops, within the amniotic fluid. So far the associated abnormalities are concerned, it would be associated with the intestinal atresia. Liver herniation would not be that much frequent. It would be infrequent. As far as the ascites in the pill in the child is in the fetus is concerned, there will be no fetal ascites. So far the cord insertion is concerned, it would be appear normal. This is a gastroschisis ultrasound image. You can appreciate that the free bowel loops can be seen within the amniotic fluid. The one thing you should have to take into account, whether this is umbilical cord or this is true intestinal loops. For that you need to have the Doppler signals on it. After Doppler signal, you can confirm whether this is umbilical cords, veins, or this is truly intestinal loops. Another scan from the different image here, you can see to the caudal area, this yellow arrow is indicating that this is the bowel loop coming out of the anterior abdominal wall, and on the top you can also appreciate the umbilical cord and umbilical veins as well. So this is another example of gastroschisis. So another example here, you can also appreciate that in the transverse view you can see that there is a intestinal loops coming out of the anterior abdominal wall, and it's floating within the amniotic cavity. So it is quite easy to appreciate on the ultrasound imaging, and you can easily pick this on the ultrasound imaging, and you can comment on that the patient has an gastroschisis. If you come across with such pathologies, clearly mention it on your report, mention your concern, advise further workup, so that the gynecologist should be aware of that what is needed to be done, and for the future planning they can manage the patients accordingly.